Novo Nordisk's Canadian patent for weight loss drug Ozempic is set to expire in January 2026, opening the market to generic competitors. Joining us this morning is Dr. Justin Ezekowitz, professor at the University of Alberta. Good morning to you. Such an interesting topic. You see so many people, whether it's on social media, going for the Ozempic diet. There's more of a serious need for it. That's probably where the drug came from. Why is there a surging demand for medications, and what are they used for?
Yeah, well, good morning, and thanks for covering this important topic. What we've seen is a really surge in the kind of interest in this area with semaglutide, or Ozempic as a brand name. And a lot of it's because we do have a lot of patients who are overweight or obese, and that's a growing global phenomena, not just Canada. And in Canada, about a third are overweight or obese. So we're seeing a lot of people who are interested in perhaps losing some weight and getting to a healthier weight that's relative for them.
Okay. Is this a magic pill for weight loss and, in turn, health outcomes?
So this group of drugs have been around for some time, and they've just improved in their quality of and their safety, their efficacy, their ability to do the things that they want to do. Are they a magic pill? Well, nothing is perfect. Okay. And it's always best when these medications, such as Ozempic or semaglutide is the generic name, are used in combination with everything else, eating well, getting regular exercise, and that's kind of the key. It's not one thing, and I think we have to keep that in mind. It can't just be a magic pill. It is part of a whole suite of health-related things we can do.
So almost creating more of a lifestyle around the weight loss, not just using the Ozempic or the drugs for that.
Absolutely. Even for people who do start on Ozempic or semaglutide, they do have to change their diet and eat healthier overall, and that does actually encourage people to eat a healthier diet. We also encourage them to get around to exercising, doing all the things we've been recommending forever, because those things also do work well for other causes and preventing other disease.
Okay. How will these generics affect the affordability and availability of the drugs?
Well, it's kind of really broken into two big camps. There's the patients with diabetes for whom there's been an availability for a long time, which is quite important. For patients who are using for weight loss and weight management, that's where it's probably going to have the biggest impact. Whether or not these medications are substantially less expensive and affordable, available, all those other factors in Canada is certainly we'll need to wait until they've been released and priced, because I think many patients, if they're paying out of pocket, will want to look at that.
What should people consider when debating maybe going on one of these drugs for weight loss, or maybe even seeing it in the social media realms as far as, is this good for me, or is this something I should consider?
Well, there's a couple of things. I mean, getting very high quality, valid information from kind of reputable internet sites is going to be the first part. So trying to avoid the lower quality advertisement-based sites, that's probably one piece of information. The other part is to think of this as a long-term strategy. It's not just one and done. You have to think about this as over the next 12 to 24 months, so 1 to 2 to 3 years. How do I want to change my lifestyle to accommodate this medication so that I can achieve whatever goals and weight management goals you have? So it's not a short-term solution for people. And I think that's part of when we're talking to patients, to get them to realize that's a very fundamental thing to think about.
And it's not without side effect as well. What are some of the side effects that people might not be aware of?
So the biggest side effects are the GI side effects, the stomach side effects, and those things are compared to placebo, about 1 in 10 people have a GI side effect, and it's amplified if they kind of don't follow the rules, quote unquote, the rules of using this medication. And I think that's where we also run into trouble, is we don't counsel people well enough in advance as to how to use this medication, how to take smaller meals, how to drink more fluid, all those other things. But about 1 in 10 will have a stomach-related side effect that is going to be meaningful and maybe take them off the medication.
And so if this is something maybe we want to consider, who should we be going to for the best advice on it?
Well, I'd say there's probably a couple of sources. First of all, start with your physicians and medical team involved. The second is your pharmacy, and pharmacists have a lot of experience now giving these medications for many years. So that's really two really good high-quality sources. The third is to go to really high-quality, valid medical or medical-facing for patient websites that are very focused in on this. Obesity Canada and Health Canada both have sites based on just this information. And so I'd really focus in on getting that those three things.
Okay.
I find that when we send patients with a new prescription with semaglutide or Ozempic, we do have our pharmacists do a fair amount of counseling, and that also does help a fair bit. And then dietitians or nutritionists can also be substantially helpful here.
Perfect. A good way to maybe encompass more of a healthy lifestyle. I want to thank you for joining us this morning.
Thank you.
For more information, you can always go to the sites as the doctor talked about, and we are back after the break.